Hi guys, welcome to Plasma. We're going to discuss development of stomach. So first we'll discuss the introduction part. It develops from the foregut in the fourth week as fusiform dilatation and close approximation to respiratory diverticulum in primitive thoracic region, and there is growth to lengthen esophageal region, okay, which is essential for positioning stomach in abdominal cavity below the diaphragm. And if this growth doesn't occurs, then there is presentation of diaphragmatic hernia wherein stomach will remain in the thoracic cavity and further which will compress the lungs, right? Now rotation occurs in two parts, that is first is the longitudinal axis and other one is the anterior posterior axis. Okay, now this in this image you can see there is longitudinal axis, and in the longitudinal axis of rotation there is 90-degree clockwise rotation of the stomach, okay, wherein the left side of the stomach will face anteriorly and the right side will face posteriorly. Therefore, left vagus nerve initially it will supply the left side of stomach, okay, but after the rotation it will supply anterior wall, and similarly after the rotation right vagus nerve will supply posterior wall. And also there is during this rotation what happens is that the posterior wall of stomach will form greater and lesser curvature, okay. So the lesser curvature and the greater curvature is formed by posterior wall, and also there is one more point that the posterior wall grows faster than the anterior portion, right? Now next what we are going to discuss is the anterior posterior axis. Okay, so this is the anterior posterior axis. You can see the direction of the rotation. Okay, so what happens here is that cephalic and caudal ends of stomach originally lie in midline. Okay, so the cephalic and caudal ends originally they lie in midline, and during further growth rotation occurs in anterior posterior axis such that the caudal or pyloric point moves to right and upwards. Okay, and cephalic or cardiac left and slide downwards. Stomach, the final position of the axis is above left to below right. Okay, here you can see, and what happens is that the stomach is attached to dorsal body wall by dorsal mesogastrium and ventral body wall by ventral mesogastrium, which is part of septum transversum, right? Now, what happens is that as the liver grows in this region, so mesoderm forming ventral mesogastrium, it becomes thinner, okay, and forming two parts of ventral mesogastrium. First will be lesser omentum, and second is falciform ligament. So you know that lesser omentum it connects stomach to liver, right? And falciform ligament connects liver to ventral body wall. Now, stomach rotation and there is disproportionate growth, okay, and so therefore the ventral mesogastrium connection gets altered, and the rotation in the longitudinal axis pulls dorsal mesogastrium towards left, creating space behind the stomach called omental bursa, lesser peritoneal sac. Okay. Now further it will be discussed in the second part. Thank you very much for listening. Thank you very much.